Rock Health and Wellness Center, and this is Life with Jason Clemmons, DC. Hope you guys are having a fantastic Thursday, March 14th, Pi Day. Yeah, I got to break that down right quick. I hope all you guys are doing well. We're live right here at the Rock Health and Wellness Center studios in Lubbock, Texas. We're on 98.7 Walk by Faith Radio and 1420 AM Lubbock Christian Nation. We're on Facebook at the Rock Health and Wellness Centers. I'm looking at it right here. We are actually live right now. We are on YouTube and we are on X. So you guys, you want to catch us, you can catch us, and you can learn about health and wellness. And we're glad that you listened to the show. I appreciate the feedback. If you got any questions or anything for us tonight, send us a text, 806-794-0400. We'll be glad to answer your text either on air if it's possible, or I'll get back with you as soon as I can off air and answer any questions that you got. Or if you want to send us a message on social media, feel free to do that. I'll be glad to do that. I missed one this week, and that MJ Lewis sent us about green bananas are okay. They don't have polyphenol oxidase that breaks down your good polyphenols that you get from blueberries and strawberries. So if you want to put those in your smoothies, as far as that goes, that's fine. But yellow bananas, ripe bananas, will break down and cause an 84% decrease in those good flavonols, flavonols. And so I hope you guys got all that. If you didn't, go back and watch the show. It's on Facebook. It's on YouTube at Health from the Rock, the at signed at Health from the Rock. You can go back and check us out and catch any of those old shows. Try to learn some of that stuff. You know, it's interesting that I have conversations in my office with patients every single day about things that we cover every night over and over again on this show. And it's obvious to me that they're not watching the show. They're not paying any attention to the show. And it's like, that's part of it. I try to tell them, hey, look, have you caught the show? Did you listen to what, any of the things that we've been talking about? And so you can only do so much to help people. But we're trying to get better at it. We're trying to make the show good. And so this week we've been talking about movement, and we're going to continue talking about movement tonight, but we're going to get outside a little bit. We're going to talk about, and I'm going to show you some things, but we're going to talk about spinal segment movement, but we're also going to talk about global exercise and movement. And so it's kind of been the theme for the weeks, and when we still got stuff to cover. And so I just want to keep on going with the movement thing. But let me get back to that Pi Day, right? 3.14, right? That's what we got today, March the 14th. That's the first thing I saw was Pi Day. And I hope you understand that's a mathematical equation, and it's trying to get you to, it's not an equation, it's a formula, whatever, I don't know, some sort of math product, right? And it's trying to get you to do math, to love math, trying to get you to love geometry and understand area. And, Pythagoras would be happy with us all for celebrating this day. It's not about pie, right? You don't need to be eating pie today. Let's don't get confused about what this day is about. So all you people out there that got confused and think it's P-I-E, Pie Day, no, absolutely not. That stuff is toxic. That stuff is bad for you. It is going to cause all kinds of negative effects in your body. Inflammation, Alzheimer's, cardiovascular disease, all that stuff, right? Nobody wants that stuff. So just don't get confused. This is a public service announcement. Just don't get confused on today about what today is about, because it's P.I. Day. There's no E on it. Just don't forget that confused. People try to trick you. You got to watch out. You got to watch out for every cunning and craftiness of men. And, the schemes that they got going on from the devil. They try to take a perfectly good math day and turn it into some sort of dessert, right? That's not what, they can't trick us. The good listeners of the Life with Jason Clemmons, DC, you guys know better than that. There's no way that you could get tricked over something like that. That is a deceitful thing that the schemer does to try to get you off your mark. So we recognize it, we claim it, we look at it. It's like, look, you can't knock us off with something that silly. That's about math. And of course we love math because we love learning, right? That's what math's all about. So I think it has to do something with area, the area or the circumference or something of a circle, right? I think it's the area of a circle, right? Pi times radius squared or something. I don't know. I don't remember. I did good when I took it, but I don't remember exactly what it is. But that's a math. So just when you see those people that try to bring you a pie today, try to sell you a pie today, don't fall for it. Don't fall for that one. Enough of that silliness for tonight. Hey, wheat germ oil. The supplement of the day is wheat germ oil, and I don't know a ton about wheat germ oil. My learning curve my depth of knowledge about wheat germ oil is not very deep. It's about 3 sentences and probably get us through the whole thing. But I wanted to bring it up today because you may have never heard about it, and it's really good for scars. So we've talked about it once before on the show, but wheat germ oil fortified contains wheat germ oil and is strengthened with 33.4 milligrams of natural vitamin E extracted from sunflower oil. Provides ingredients with antioxidants activity important for cell signaling molecules, supports the cells of the immune system and the body's natural inflammatory responses, functions as it relates to periodic challenges like consumption of a high-fat meal or strenuous activity. It's an excellent source of the antioxidant vitamin E. So that's where we were talking about the bananas, right? The bananas, the ripe bananas with the polyphenol oxidase will block those antioxidants that we get from our blueberries and our strawberries if we put that banana in that smoothie. And so according to the research. So this wheat germ oil is an excellent source of the antioxidant vitamin E. But why I wanted to bring it to you tonight is it's what we use. It's what we use when we do scar treatments. Thank you to Dr. Fraley in Ruidoso, New Mexico, about teaching me about scar treatments. So whenever you cut your skin, then you are cutting through nerves. If you don't believe me, no, don't do that. When you cut your skin, and everybody who's ever cut their skin totally understands that you can cut through nerves, and because it hurts, right? You know it hurts. And then when it gets inflamed afterwards and it's trying to heal itself, it hurts and you get a scar. And whenever you have a surgical intervention, like you have a knee replacement or a shoulder replacement, or you got some sort of scar from like a C-section or something like that, then you want to make sure that you treat that scar properly, because the body is going to pull in metals to help firm that scar up. And now you got metals inside of those free nerve endings, and it can cause disruption in your nervous system. And so the little Dr. Fraley showed me these little dude called dolphins. And dolphins are little microcurrent, little neurostem microcurrent little machines. Now what we do is, I've showed them to you before, but we take both of them. We take two of them, we put one on positive, we put one on negative. They make a little beeping sound when you turn them on, a little beeping, squealing sound like that. You can kind of hear that on the radio. And then when you press down on it, it makes kind of a little beeping sound like that, but it's a microcurrent, and it's positive and negative on both sides, on one side and the other, and it pushes those metals out of that scar. And then after we get the metals out of the scar, then we come back and use the wheat germ oil over the top of the scar. So it's one of the things that we use for that. And I've had some crazy, amazing results with this so far. I had one girl who had 2 C-sections who was having all kinds of trouble after giving birth. She used to be a runner, and she was having trouble. She couldn't run. It was causing all kinds of difficulty for her. And we did some AMIT technique with her, and which is muscle. It's a muscle technique that we use to turn muscles back on that have been neurologically inhibited. So we used the AMIT technique, and we used the dolphins on that C-section scar with the wheat germ oil, and it changed her life. Like, it really made a huge difference, solved the problems that she was dealing with. And she told me today when she got adjusted that she just said, she said, "Have I talked to you since I run my half marathon?" And I said, "Nope, I haven't seen you since then." And she said, "Yep, I set a personal record." So she PR'd her half marathon time, and is back on her running track and all that sort of thing. And I'm not super fired up about the whole long distance running deal, but that's something that she loves to do. She feels good about it. It helps her brain and all that sort of thing. So um, I was happy for her, and she was just ecstatic that she was able to do that after, and she was able to get back to her training after we had done the scar work. I had one of my older ladies that I take care of. She's probably in her 70s, um, and double knee replacement. And we did the scar treatment on both of those knees. And she told me this week, she was like, I meant to tell you, because we did it a couple weeks ago. She said, "I meant to tell you, but um, she said, I really think that scar treatment, my legs just feel so much better since you did that scar treatment." She said, "I didn't even realize that they weren't feeling great because it's been so long, and I just kind of got used to it." She said, "But once you did that scar treatment, it was really amazing." So I just wanted to share that with you. Dr. Fraley, I got to give him all the credit. He's the one who taught me all about it. And we got it. We implemented it. We're using it. And if you've got a scar somewhere, it's crazy how it can disrupt how your nervous system is functioning. And that's what we do. That's what we do personally with the wheat germ oil. Obviously, it's good for you in other areas as well, but that's why we keep it in the office. And it's pretty simple. I mean, you can cut the little soft gel. You can just cut the soft gel open at the top, and then just take the oil, just rub it on you get it on your finger, just rub it all over your scar. And there's actually some research. I was looking for it right before we came on air. I was looking for that article, and that I didn't have it handy right now, but I've got an article that's from research that talks about how wheat germ oil is good for treating scars. So why do I care? Because the scars create the nervous system interference, and that's my job. My job is to detect and correct interference in your nervous system, called a subluxation. And where does that subluxation come from? Physical, chemical, and mental emotional stress. And what kind of physical and chemical and mental emotional stresses? All of them. So, all of them. That's my job. And I've got a handful. I got my hands full trying to do that every single day. There's a lot of options where a person can have physical, chemical, or mental emotional stress, or the combination of all of them. And so we're constantly working to get better all the time, to try to learn as many things as we can about the nervous system. And I think if I work on it until I'm 113, because that's my goal, I think if I work on it until I'm 113, I will eventually learn one little sliver of how much all the things about this magnificently made human body that we have. And so it's just a pleasure and an honor, a blessing to get to do this every single day. I am the luckiest guy in Lubbock, and to be able to do this, and that's just one of the things. That's just one of the things that we do. So I had a comment this morning, because we've been talking for the last few days about immobility. That we pulled up the article. We talked about how immobility was pathological to the musculoskeletal system, and was a causal factor in degenerative joint disease. And so those articles that we were talking about, I was trying to share that information with you, because I was trying to show where at a joint mobility or joint immobility standpoint, that was bad for your body and for your health, right? Because if your joints aren't moving properly, and that's something that it's really hard to know by yourself. It's hard to know with by like testing range of motion. Remember we talked about rotation, where you look on both sides, see if you can move your head in both directions. Well, um, sometimes when you have a joint that's locked down in the cervical spine in your neck, you can still make up for the range of motion in the other joints above and below it and end up with the same range of motion. You can have the same range of motion, but if I was to what we call motion palpate your neck, if I was to feel of your neck and I could and then try to move your neck through those certain range of motion, that oftentimes that's what I can feel is I can feel that restriction or that lack of movement or that immobility that is in your spine that I want to get to move. I want to get that joint to move, and that's where the adjustment is. That's where we add a force to a joint that's not moving properly, and we do it in a very quick and shallow manner. And we're careful about rotation. We're careful about all that sort of thing so that we don't create any sort of damage to the joint. But we want to make sure that it's moving properly because we want to stop that pathological effect, that disease-causing effect that goes on at the segment. And I worked on the joint. I worked on the entire spine today. And even in the week, I've worked on the entire spine. I worked on the TMJ. I worked on the wrist. I worked on fingers, wrist. I worked on an elbow today. We did some laser on a little 13-year-old pitcher that pitched a little bit too much over the weekend, threw too many curveballs, ended up with some soreness in the elbow. We adjusted the elbow. We adjusted the brain. We adjusted the spine to affect the brain. And then we adjusted the elbow. I did some soft tissue work on the elbow. And then we sent him across into the brain center to do the cold laser therapy on his elbow. So those are some of the things that just for that joint that we've worked on. One of my ladies having elbow problems, pain radiating into the elbow, but coming from the neck joint and a joint in her neck. And so even though the elbow was hurting, the treatment was neck related, cervical tractioning, long axis tractioning that we did in the office to relieve some of that pressure on that nerve. Talked about circular tractioning that we do with the wedge, where we actually put you on your back and stretch in a circular pattern to get your neck to resolve and to get a better curve in your neck. Those combinations, that's areas of the body that we worked on. Worked on hips, worked on knees, adjusted feet. All that stuff is stuff that we've done this week. Why? Because every joint in the body can have a joint movement problem that disrupts the nervous system, that causes the body to break down and to have malfunction. That's chiropractic care. That's chiropractic wellness care. The wellness part of it is to try to use technology and understand the philosophy so that you can approach it properly, that we work on the subsymptomatic level as much as we can. So I'd rather spend my day, even though I had two or three for sure, disc problems, low back pain disc problems today that were flared up and people couldn't even sit in the chair. They couldn't even stand up. Three of them today that I remember. One of them was lifting leaves from working in the yard over the weekend. One of them was from traveling, flying in a plane, and riding a taxi or an Uber or something, back and forth, and then and doing that. And then the other one was a result of having some sort of virus. So the person had a virus and didn't feel good. So what did they do? They sat around all weekend, or actually it's been 2 weeks since they've been dealing with this whole virus thing. They've been tested. They can't figure out what it is and all that sort of thing. Well, they've been sitting around. Well, when you lay around and you lay around in bad posture, then you put pressure on your spine and you can bulge a disc. And this person has been dealing with a bulging disc for quite some time. And so that's what they ended up with, is that disc bulging again. So the same symptom with 3 different people with 3 different causes, all of those ended up in the same spot having some sort of disc issue, right? So all 3 of them had immobilization problems in their spine that wasn't able to adapt to the activities that they were asking their body to do. And it was in that whole immobilization is related to brain function that's causing the joint not to move like it's supposed to. Then when they go to do their activity, they can't complete their activity because their body's not moving properly. And then they end up with some sort of acute low back pain. And acute low back pain will knock you down. Like, I don't, if you guys have ever had that, I mean, like, especially down L5, S1 area, like right down at the bottom of your spine, right above your tailbone, man, you get into that kind of low back pain, and it'll shut you down. It's the core of your body, right? We always talk about core strength. Well, core strength and like the core belief system, or the core of your marriage, the core of your family unit, like all those things that are the core, like dead center of the whole thing that everything kind of revolves around. That's what happens when you have that same low back type of issue going on. And man, it'll you if you've had it and you understand it, you totally understand how it'll knock you down, right? So we want to avoid those things. But I share those stories with you because I want you to understand. I want you to understand about chiropractic. I want you to understand about your nervous system. I want you to understand about the things that we do to address your nervous system. I want you to understand how we treat you as a person, as an individual person, and look at all of the things that might be going on with you, not just treat you as one type of person, right? There's a lot of stuff that goes on that we work on. So we were talking about immobilization. And so I want to show you a couple pictures for you guys on the radio. I want to show some pictures, and you guys can check this out on the Facebook page. A lot of times Ken Adams shares this stuff on the Walk by Faith Facebook page as well. And so you can kind of see what's going on if you go back and look at that. But I wanted to show you so that you understood. Let me see if I got the right one. Hang on. I don't have the right one. There we go. All right. So I've got 2 x-rays on the screen right now. And I've got the normal, and since we've been talking about immobile spinal joints and the pathology that goes along with them, and to understand that, I wanted to show you a few pictures tonight so that we could kind of drive home this idea, right? This right here is what we call a normal cervical curve. This is an x-ray of your neck from the side. Here's your teeth. This is the person's jaw. There's the teeth right there. And for you guys on the radio, what we're looking at a kind of a half circle. That half circle that's bent, it kind of looks like the shape of a banana a little bit, right? There's kind of a half circle like that is right there in your neck. That's what it ought to look like. That's the way the bones, if you study the angle of the bones, if you look at the way the discs are made, if you look at neutral position or posture, that's the way all that's supposed to look. And so if you have proper if you have a proper cervical curve and those joints are moving properly, there is just a tremendous amount of value in that right there for your overall health and wellness. There really is. There's a tremendous amount of value, and I could probably spend another month going through and talking about that. I might could do a whole week just on facet joints, these joints that are in the back, and how they fire into the brain, and how important they are in firing into the brain. And so this is what you want. That's the way you want your spine to look. That's what you want it to be like. And we're fixing to take a break on the radio, but when we get back, I want to show you what an abnormal, what happens when we start to lose that curve, and then what happens to us down the road if we've got that immobilization problem going on and that abnormal chemistry going on. So I want to get into that, and then I want to talk about movement, and the movement from a global perspective, because that was one of the sentences I got this morning about exercise. And exercise, she was afraid that, she's like, I move a whole lot, I exercise a whole lot, and I get sore, so should I not exercise? So that's going to be what we talk about on the other side of the break. We're going to check those two things out, and then we're going to talk about spinal movement, and then we're going to talk about global movement. So I hope you guys will stick around with us. This is Jason Clemmons, and you are listening to Life with Jason Clemmons, DC. Okay, so this cervical curve that we're looking at, that you guys can see now on social media, this cervical curve here. Let me make sure you can see that. Yeah, the picture on the left. That's what we want our neck to look like. And one of the first things that happens is we start to lose that curve. Now you can kind of see how, if you looked at that red dotted line of the picture on the right, that red dotted line is what we would consider to be forward head posture. And it's interesting because if you look at the angle of the atlas, which is the first vertebrae in the neck, like we've got a pretty good atlas angle, but we've got this forward head posture going on. And this tells me that it hasn't been there for a super long period of time, and that it's still moving relatively well, and that the chemistry is relatively well. But the thing about degeneration is it takes time. You can tell by looking at a spine that whether or not that spine is this is kind of a new thing, or if that's kind of been there for a while, or if that person is still able to move those joints properly. But because you can kind of look here on the picture on the right, and you can see how the disc space is still proper. Like there's still good space in each one of these discs, even though the head is forward. And there's lots of problems with forward head posture. All the muscles are on the back that keep us, when our head goes forward, then we've got all these muscles on the back that go into what's called a stretch reflex. And now they're going to go into contraction. And so you're going to get tightness in the trap. You're going to get this pain that goes right here at the base of your skull, where you get the headache that comes around to the eyeball. Hang on, let me get us back on the radio. Okay, everybody, we're back. This is Life with Jason Clemmons, DC. This is Thursday, March 14th, and we're talking about immobility and mobility and cervical spine and joint degeneration. So we've got a couple of X-rays that are up on the view box for us, on the screen for us tonight, and we're talking about what happens when we lose the cervical curve. So this person on the right is, in my evaluation, and they've lost their cervical curve. There's multiple things going on with them at the same time, and it's causing abnormal biomechanics, abnormal movement, because one thing you've got is forward head posture. When we look at the back of this bone right here, so we look at the back of C2, which is the second vertebrae in your spine, C2 right up here at the top. If we look at the very top back part of C2, it should be on the green line. So we shouldn't see any forward head posture. So this is going to be more than 1 inch. I'd say that's probably about 1.5 inches. But for 1 inch or 25 millimeters of forward head posture, you put an extra 10 pounds of pressure on your low back. And one of the things that I've studied, and I had 2 conversations about it today, is this technique that we call chiropractic biophysics. And this is the 24th year that I've actually been studying chiropractic biophysics. Actually, this week is the 24th anniversary of when I started into chiropractic. And in 24 years, I can tell you this: I've had Tylenol one time and I've had Advil one time in the last 24 years. I've had 3 antibiotics, and that's 2 of them were for tooth, and 1 of them was for whooping cough that my wife had. And she was quarantined for like 5 weeks in her bedroom, and I was the one taking care of her. So my point is, I learned 24 years ago, I learned what a subluxation was. I learned what interference in the nervous system was, and that's what led me on this 24-year journey to be with you here tonight talking about cervical curves. It's been an awesome last 24 years to get to study this stuff. And one of the very first things that I studied at the very beginning was structural biomechanics, structural rehabilitation of the cervical spine in CBP. And there's a lot of information in this book. I'm not going to go over all of it, but I'm just going to go over some of it. But it says, just one of the paragraphs right here that I've had highlighted forever. It says, firstly, it is known that chronic neck pain subjects exhibit clinically and statistically significant reductions in cervical range of motion and isometric torque in both the flexors and extensors. Secondly, it is known that chronic neck pain subjects often have excessive anterior weight bearing of the head compared to the shoulder. And this is stuff that is documented and cited in research articles. These guys are some of the top research guys in our entire profession. But those 2 things, chronic neck pain subjects exhibit clinically and statistically significant reductions in cervical range of motion and isometric torque in both the flexors and extensors. That's what I'm saying. The flexors and the extensors both get disrupted, interfered with. My flexor muscles, a lot of the time, my flexor muscles are hypertonic because of my frontal lobe. My brain is not turning them off. My extensor muscles are hypertonic because they're in a stretch reflex, because now my head has gone forward. The muscles that are on the back of my neck, the neck and shoulder muscles, my trap muscles, my levator scapula muscles, my scalene muscles, those muscles and that are my rhomboids that come right off your shoulder blades and attach to your spine. We get a lot of trigger points in all of those areas. And a lot of times those muscles are in contraction because of forward head posture or a combination of neurology that's not firing down inhibiting flexor muscles, and then the flexor muscles are causing me to bend forward, which is causing this stretch reflex again on the back side. And so that's the first thing, is the clinically and statistically significant reduction in cervical range of motion. Cervical range of motion, what are we saying with this problem? That immobility is pathological. It's disease causing. It causes pathology. It causes degeneration. Immobility causes degeneration. Secondly, it is known that chronic neck pain subjects often have excessive anterior weight bearing of the head compared to the shoulder. That's what I'm talking about right here on this picture on the right. I'm talking about anterior weight bearing. If you look at where the ear is in relationship to where the shoulder is, this person is in forward head posture. Now, I know 2 things. More than likely, I know we've got a decreased range of motion, and I know that we've got forward head posture. I know that those 2 things are most likely occurring right here. So I could check range of motion, but I can also check based on some of the x-rays that we do, I can check cervical range of motion at the joint level. And so we could do a flexion extension x-ray, we could do a lateral bending x-ray and see if we've got immobilization right there. And a lot of times we do. And so that's the early stage of it. But then later on, what we get is if this particular thing goes on for a long period of time, then what we will end up with is we'll end up with degeneration. And you guys have seen this picture before, but I think it matters today because it stacks. And since we've been talking about immobilization, then you can see we still got on the right-hand side, we still got the normal cervical curve. For you guys on the radio, we're looking at an x-ray of the neck from the side. We've got the jaw, we've got the teeth. Every one of the bones is right on the green line. So the back of each one of the vertebrae in the neck is right on the green line. It's right on the curve. It's right where it's supposed to be. Now you come over here to this one on the right, and now you've got degeneration. You've got multiple levels so we've got forward head posture. We've got what we're talking about here in the book. We've got forward head posture. We have an atlas that's at a different angle. If I was to draw a line through the middle of that atlas right there, that atlas is going to be sitting on a different angle than this atlas is in the normal picture. So that's one of the things that I can see right there. Now we have degenerative changes in the facets as well. We have all kinds of degeneration here. We've got decreased disc space. We've got increased bone density in multiple areas of the spine. We've got bone spurring that's going on. And those are all findings that are results of, if we go back and look at immobility, abnormal range of motion, and forward head posture, and and chemistry, abnormal biochemistry, too much inflammation, too many cytokines, an imbalance of an omega-6-3 ratio, those things that we like you guys get tired of me talking about because I talk about them over and over again, right? That is so important about the cervical curve. So if you have lost your cervical curve, you increase the chances of developing this chronic neck pain or radiating pain running from your neck, down your shoulder, down into your hand. Like that radiating pain is because the pressure is getting on those nerve roots at the spine itself. And now we're creating irritating chemistry around the spine. We can actually we can have physical pressure on the nerve, not so much from the bone, or sometimes from the disc, sometimes from the soft tissue that's around it, and we can create an inflammatory response that's going on around there, which makes that nerve super sensitive. And now you'll get that pain that goes down between your shoulder blade. You'll get that thing that comes down your arm, right? In this particular person, because I know this person, and this particular person on the right, one of the things that you always have to watch out for is that this person does not have neck pain. And I know that you may not believe that, but that's factual. This person does not, as nasty as this spine looks, this person does not have neck pain. And so you have to be super careful. That's why I'm really you guys hear me talk about it, and I've talked about it lots of times. The person on the right has degenerative disc disease at multiple levels. They have bone spurs. They have loss of cervical curve. Like, this is just ugly. This whole thing is ugly right there. But this person does not have any neck pain because the spine, in spite of its degenerative changes, is functioning at a level that's below the threshold of pain, so that this person's neck doesn't hurt, right? So if their neck did hurt, they would go to the doctor, and the doctor would tell them that the reason that their neck hurts is because of that. And the doctor would tell them that they have arthritis. And you probably have been told the exact same thing by your doctor. I get it all the time. Now, maybe not every day, but I get it multiple times a week where someone tells me something about, well, yeah, I've got arthritis in my spine. That's not factual. You have your spine may have. I went to the doctor 4 or 5 years ago. They told me I had arthritis in my spine. No, they should have told you that you have degeneration in your spine, right? When your spine doesn't move, it degenerates. Okay, I think we made that point. If we haven't, I'll keep working on it. I just want you to know it. If you've lost your cervical curve, one of the things that we do in the office. Let me get back to this right before I leave it because it is super important. One of the things that we're going to do is we're going to I don't know if I can. Let me see. I was going to see if I could mark on this x-ray, but I don't know how to do it. So on this picture, but there's two types of tractioning. There is long axis tractioning to help those joints, the disc, open the disc space, take the pressure off the nerve. That means we're pulling along the long axis of the spine, long ways, pulling long ways. We call it long axis traction. The other is circular tractioning. Circular tractioning means we're coming in with a fulcrum, like we do with a wedge, and we are bending the spine over the circular tractioning. Those are the two different types of tractioning that we do. We do them at different times based on what the patient needs. If the patient is not able to get into extension for whatever reason, could be multiple reasons, if they can't get into extension, then we might use long axis tractioning in the beginning to try to get some space in there before we go into that circular type movement, right? But what I want to tell you is when you come into the office and we evaluate your cervical curve and we look at that, then we're going to tell you, I'm going to tell you, look, here's your cervical curve. Here's your angle. Here's your forward head posture. Here's where your spine's not working properly. And I'm going to make a recommendation that you go home, you take a Dakota wedge traction unit, and you start doing your tractioning, and you start doing that tractioning, and you work yourself up to 18 minutes, and you do that 5 to 6 days a week. And you do that for the rest of your life until you've stabilized that cervical curve and restored that cervical curve. And then you do that 3 or 4 days a week to maintain that cervical curve, because your body's going to try to go back into flexion. You're going to want to get yourself back into flexion. Your brain's going to try to pull you forward. Your phone is going to try to pull you forward. The world is going to try to pull you forward. Everything's trying to pull us forward, and that's going to reinitiate the shortening process. It's going to reinitiate the brain, getting our eyes down and in, turns off our frontal lobe, turns on the muscles in our neck, makes these tight muscles pull us forward, and then we're back into it, right? So I make these recommendations about cervical tractioning. Almost no one follows these recommendations. They'll get a traction unit, they'll take it home, they won't use it. They won't do their tractioning. And then their necks get all jacked up. And the thing I'll ask them is, are you doing your tractioning? And they're like, no, it's uncomfortable. I don't do it. I forgot. I don't know where it is. I used to do it. I don't have time to do it. I don't have to think about it. All the things that people say. And it's like, you can address it. You can address the immobilization, which is pathological. You can address it before it goes bad, or you can wait till it goes bad and then you can address it. And when it goes bad, you're going to have pain, and you're going to have radiating pain, and it's going to hurt like crap, and you're going to wish you would have done something about it beforehand. There's a difference between the philosophy of wellness and the philosophy of pain management. And it's pretty much a when, not if, and a lot of times with that cervical spine. So Just having said that, that's the part. That's the part that we talk about, that I've been talking about for the last couple of days, about immobilization of your spine when your spine's not moving properly. Now, what I want to talk about, because this morning, what my lady told me that I love to death, and she's a huge part of our practice, and she's an awesome woman. But what she told me this morning was, I moved a lot over the last few days, and now my whole body aches. I'm sore. So should I not be moving? Because when I move, I hurt. But when I don't move, I deteriorate. So what should I do? Right? And I'm like, okay, I didn't do a very good job in the early part of the week talking about what I was trying to talk about was immobilization of the joint segment in the spine, or in the shoulder, or in the wrist or elbow or the knee or the ankle, anywhere that's not moving properly. I was trying to talk about those segments of the spine and how the articles in the journal Pain and the uh, molecular biology, whatever we were listening to, wherever we were studying from, how those articles were talking about that type of immobilization is pathological to you. Well, let's talk about global movement now in the form of exercise. And I thought I'd just pull back out the Spark book. And we did a breakdown of this earlier last fall. You guys that haven't been watching the show, it's John Rady, MD, Spark. It's about exercise and movement. It's about all kinds of exercise and movement. And you wonder, well, is exercise important? Like, it's comical in 2024, right? It's comical in 2024 to say that question out loud. Like, is exercise important? Like, what person on the planet doesn't know by this time that we should be exercising, right? What person does not know that? If you're seriously one of those people that don't know that, well, let me just share some information with you. Exercise is important for health. You might even consider it to be vital for health. Like oxygen is vital for health, right? Like, you're not going to be healthy without it. And you almost could make an argument that a person is not going to be healthy. I know somebody will say, well, my grandma never exercises and she's 90 years old. Okay, there's a few of them out there. But exercise is super important. And it's important for lots of different things, right? And just one of them on page 230 of the Spark book talks about dementia. And dementia is a loss of function that dramatically undermines our ability to get through daily life. It happens when a particular area of the brain is impaired or shuts down, not unlike when we get a fuse blown in our home's circuit breaker. The kitchen appliances may work fine, but the lights in the bedroom have gone dark. There are different types of dementia depending on which circuit is down and what is tripped. The most common form by far is Alzheimer's disease, which is marked by inflammation and the buildup of amyloid plaque that begins in the hippocampus and spreads to the frontal and temporal lobes, as well as intracellular waste called neurofibrillary tangles. According to the 2000 census, about 4.5 million Americans have Alzheimer's, and that number is expected to triple. More than 13.2 million over the next 50 years as baby boomers enter old age. So it can go through and it talks about the different kind. The most common forms of dementia is Parkinson's disease, which is a dopamine neurons, which the dopamine neurons in the substantia nigra get depleted and cut off the flow of neurotransmitter to the basal ganglia, which the brain's autonomic transmission. So we know that it's all about brain, right? The basal ganglia is necessary to smoothly shift between mental and physical tasks and start and stop motor movements. When dopamine runs dry, it's as if the transmission fluid has been drained, thus the classical tremors of Parkinson's. So it gets thin, and it goes through and it talks and it keeps talking. So Matson, this guy did let's go up here. Statistics aside, we know from animal studies that exercise can redirect the biology of the brain. This is it's Spark, John Rady, MD, right here, page 231. We know from animal studies that exercise can redirect the biology of the brain. Carl Kottmann tested the effects of exercise on mice bred with a gene predisposing them to plaque buildup and found that exercise slowed down the accumulation compared to the inactive mice. The mice that exercised slowed down the dementia as compared to the ones that didn't. Exercise also prevents inflammation, which Kottmann believes might trigger the plaque accumulation. Inflammation increased in the transition stage from cognitive decline to Alzheimer's. Matson found the same sort of result in rats that had their dopamine neurons knocked out to mimic the biology of Parkinson's. The brains of animals allowed to run on wheels showed better plasticity and more connections in the basal ganglia, suggesting that they had adapted the building up circuits to compensate for dopamine decline. Remember what I said a couple of weeks ago, that when one of my ladies said she did a bunch of cardio, she got on the treadmill and did a bunch of cardio at the gym, and I said to her, we've named that the wrong thing. We should be calling it neuro. I went and did some neuro at the gym, right? Because the brains of animals allowed to run on wheels showed better plasticity and more connections in the basal ganglia, suggested that they had adapted by building up circuits to compensate for the dopamine decline. The brain actually functions better when we are exercising. So there's one study, researchers started testing the effects of exercise because it called into action the motor area that degenerates in Parkinson's. Stimulation of the basal ganglia through exercise increases the connection and boosts BDNF, brain-derived neurotropic factor, and other neurotropic factors. One study looked at the effect of using exercise in combination with L-DOPA, the common drug treatment in Parkinson's, and dopamine precursor that increases production of neurotransmitter. And so doing 40 minutes of easy stationary cycling immediately before taking L-DOPA improved the effectiveness of the medicine on motor function. And we could keep going. They could keep going for hours, right? It strengthens the cardiovascular system. It regulates fuel. Researchers at the Karolinska Institute conducted a 9-year study with 1,173 people over the age of 75. None of them had diabetes, but those with high glucose levels were 77% more likely to develop Alzheimer's. As we age, insulin levels drop and glucose is harder to get into the cells to fuel them. What do we talk about all the time? Fuel and activation, right? Then glucose can skyrocket, which creates waste products in the cells, such as free radicals in the damaged blood vessels, putting us at risk for stroke and Alzheimer's. What did I just say? Then the glucose can skyrocket, which creates waste products in the cells, such as free radicals, and damages blood vessels. Increased glucose damages blood vessels. Damaged blood vessels need cholesterol. Increased glucose damages blood vessels. Cholesterol goes up. LDL cholesterol goes up. And HDL cholesterol goes down because we've increased the glucose, because we're not exercising enough. Exercise increases levels of insulin-like growth factor, which regulates insulin in the body and improves synaptic plasticity in the brain. By drawing down surplus fuel, exercise also bolsters our supply of brain-derived neurotropic factor, which is reduced by high glucose. So, movement is vital. Movement is vital from a local spinal level. Movement is vital for exercise if we want to be healthy. And it's beautiful in Lubbock, Texas tonight. So if you've already eaten supper, you probably ought to go out there and go for a walk. It'll be great for your brain. You guys have a great night. We'll be back tomorrow night at 6. I hope everybody enjoyed the show. This is Jason Clemmons with Life with Jason Clemmons, DC, and we will see you tomorrow.